I'm back.
Okay, I'm almost gonna stress, but I'm not gonna stress now. I'm gonna stress in 2 minutes.
Okay, what's happening?
My signal is like gone. So I can't connect to Zoom on my computer, which means I cannot go live.
Oh, on the Facebook.
Which means that I cannot go live. So I don't know if we have the webinar and we just record it, or
that would make sense.
If
because at least it's still accessible, so you can post it on the Facebook group that you have, or the Facebook page.
Yeah, I'm thinking that as an option, but give me 1 minute, because I had literally a minute to figure it out. So let me mute myself quickly, think out loud and figure something out. Sure. Nopi.
Yes.
Cool. So what I think to do is, I think we can continue because I see it's still recording even when I'm cut off. I think that's what I wanted to figure out, if we continue to record. But what I'm going to actually do is I'm going to make you the host, right? So in case anything happens, in case anything happens, you'd be able to resuscitate.
Sure. Katie, are you there?
Sorry, I'm speaking on mute. Let me just admit the people who are waiting. Then we can start, I think, in like 2 minutes.
Perfect. Hi, everyone who's here so long. We're just waiting for the host as well. Okay, never mind. I'm going to start. Okay, hi, everyone. So unfortunately, the person who's sort of hosting this webinar, just ensuring that everything is working, their internet connection isn't doing so well. So thank you to the two of you who have shown up. At the end of the day, my philosophy is as long as one person is eager and really willing to learn, then that's the most important thing. So can you please just indicate if you can hear me or not? In any way, shape, or form?
Hi, I can hear you. It's breaking a little, perfect. But I can hear you.
Okay, cool. I'm so sorry about it breaking. I'm in Stellenbosch and it's very, very windy. So I think that could be sort of affecting the signal a little bit. So I will try to not speak too fast so that you can hear what I'm saying. All right, so first of all, I want to thank everyone for being intentional and making, the time and the effort to want to spend an hour of their Monday evening talking about mental health, talking about mental illness, specifically in the African continent. But before I get into the whole topic, I think it's good for me to introduce myself. My name is Unopachido Mubaiwa, commonly known as Nopi for some odd reason since grade 1, but we will not get into that. So I was born and raised in Johannesburg, but I am currently studying in Stellenbosch University. I did my Bachelor of Arts in, what did I do it in? In humanities, and I was majoring in psychology and philosophy. I then moved on to do my honors in psychology, and right now I am doing my master's in research psychology. And my research focuses on the experiences of queer students of color in relation to Stellenbosch University men's residences. So I'm still in the initial stages of it, but I'm very excited to sort of see where it's going to go. And I think more so to really hear the experiences of these students that I'm interested in understanding and really understanding how they've been able to experience these spaces that they find themselves in. Outside of that, I am an aspiring critical social psychologist. I love psychology, but something else which will always be my first love is music. And I really believe that music is or serves as a form of really maintaining one's mental health and their well-being, because I think there's a lot of just richness that it has to it. And yeah, I've really been helped a lot through music, and I hope that it can do the same for other people. But without further ado, let me not, or due, I think it's due apparently, I learned that 3 weeks ago. I will not waste any more time, and I really want to dig straight into the topic. So how I always like to start, and let me just sort of say the topic again, we're speaking about mental health care access for low-income individuals. But how I sort of interpreted this is mental health care access from a general perspective, because I think that there's a lot of people who are not having access. And I don't think access is just a physical thing in terms of getting treatment and getting care and so forth. I think there's 4 types of access, but I'm going to get into that just now. So how I always like to start, and this is a very relaxed thing, hence the knee on the chair, how I always like to start off my talks about mental health is I want to give people a proper breakdown of what do we mean when we speak about mental health, and then what do we mean when we speak about mental illness. And I think that the reason as to why there's such a lack of conversation regarding mental health is because people immediately think that in order for me to speak about mental health, I have to have been diagnosed or be suffering from a disorder or an illness such as depression or schizophrenia or anxiety. And I really want to break that misconception immediately, because to speak about mental health is basically to speak about everyday life. And, if you Google mental health and you go into these different journal articles, I think most would agree that mental health refers to the condition of an individual in relation to their psychological, their emotional, as well as their behavioral well-being, right? And that is from 3 different levels. So we have the cognitive level, so how your brain is able to process different things. We have the emotional level, which deals with your feelings and how you're able to really process that. And then lastly, it says my internet connection is unstable, but I hope you can still hear me. And then lastly, we go to the behavioral level, which is really just your actions and, how your daily experiences and, how you're navigating yourself in society is ultimately affecting how you're responding to it, you know? And I think that's what mental health is. I think mental health is the process of navigating one's own identity and one's own well-being in relation to society. And I think it's important for us to really bring in the social aspect, which I'm going to speak a lot about. So then I also think of mental health as something that ranges on a spectrum, right? And this is to really sort of unpack it to sort of the easiest level to understand. And, you know, I don't entirely believe that there's a complete opposite sides of the spectrum, if that makes sense. I don't like using binaries, but for this explanation, I'll use it. I think of mental health as a spectrum, and it's good mental health, it's bad mental health, and then we have moderate mental health. And I think that throughout our lives as human beings, we're constantly going up and down the spectrum, right? But going up and down that spectrum is also dependent on our social experiences. It's dependent on our current economic status and our current economic position. It's dependent on our food security, on our job security. It's dependent on our intrapersonal issues as well as our interpersonal issues. So basically what I'm trying to say in a nutshell is that mental health is complex, but it's also something that needs to be spoken about, because mental health is us every single day. Mental health is what we're doing on a daily basis. It's how we're experiencing life, and it's how we're navigating life. So then we move on to speaking about mental illness. So according to the American Psychological Association, and I know, yes, America, Westernization, we're always referring to them, but for just this definition specifically, I think it really does give a really great definition of how at least I view mental illness. And please note that these are all my own personal opinions that I'm sharing. I'm not an encyclopedia quoting anything like that. I'm really just trying to share from what I've learned in my experiences. So mental illness refers to health conditions, and I want to emphasize the key word being health. So health conditions involving the changes in one's emotional thinking or behavior, and it's associated with distress as well as problems in one's functioning in their social work or family activities. So that's quite a simple and quite a nice definition to sort of grasp when we speak about mental illness. And I think what I want to sort of re-emphasize is the same way that we speak about mental or physical illness. It's the exact same way, and it deserves the exact same efforts in how we speak about mental illness. And that's something that we're going to get into, because I think that's a very intense stigma. That's a very intense sort of perspective that a lot of people in the world still have when we think about mental illness, which is why we then have it as holding a very negative stigma, which it does not deserve, or the people, especially the people suffering from mental illness, do not deserve. All right, so now if we move down and we start speaking about mental health in the African continent specifically, and I don't say in Africa because I tend to just think that people, you know, when people say, oh, I've never been to Africa before, they make it seem like Africa is just like this one specific place, but no, it's not. Africa is huge. It's got a diverse range of cultures, a diverse range of people, a diverse range of countries. And I think it's important that we give it the credit that it deserves and the richness that it deserves. But with that, investigations to say that in a nutshell, mental health and mental illness has been neglected. And it has been neglected in a global sense, but specifically in Africa, it really has been neglected, right? And it's been neglected because of 4 types of inaccessibility. And this is something that I have drawn up because that's what allows me to sort of understand and really process everything. So firstly, we have the inaccessibility of the general knowledge of mental health and mental illness. And I think we have to start there. And, you know, I've been to so many talks about mental health and mental illness, and they immediately jump straight into, okay, this is what we need to do, so we need to solve it. But how can you be hosting any sort of conversation or any sort of initiative that isn't actually equipping people with the skills and the general knowledge to understand exactly why is this an issue, why is it important, and how does it affect me, right? So the first, inaccessibility of general knowledge of mental health and mental illness. The second one is the inaccessibility of a clear and concise understanding of mental health and mental illness. So one might say, oh, but Nopi, this sounds exact same as the first one, but it's not. Because there's a difference between saying to people, listen, guys, mental health is this is why it's important, like, please, we need to really give it more energy and traction that it deserves, versus when you go into different communities, you go into different contexts, you need to ensure that you're delivering the content in such a way that people will understand in relation to the specific context that they find themselves in. I find that a lot of the time, we tend to try and use a whole bunch of academic jargon to try and, explain the purpose of mental health and everything like that. But there's no point in trying to raise mental health awareness if people don't even fundamentally understand what you're talking about. So the third one is the inaccessibility of mental health and mental illness as a stigma. So I don't really think that the statement makes sense, but I wanted it to be under the inaccessibility. So I was just like, that's what it's going to be like. So what I mean by that is what I've spoken about before, is how there still is this very negative stigma associated with words such as mental health, and then with experiences such as mental illness. And I think that it's because of this whole idea of attaching mental illness with that of being absolutely crazy. And then once again, that goes with the lack of sound knowledge, that goes with the lack of sound conversation that's happened, which is why we then come and have these negative stigmas. And this also has to do with a lot of cultural beliefs as well, but we'll get into that a little bit later. And then lastly, we have the inaccessibility of then accessible mental health services. And don't get me wrong, I'm not saying that there aren't organizations and initiatives which really have tried and are trying successfully to provide communities, provide people with accessible mental health care. But if we look at the problem when it comes to accessibility of mental health services, and these services may exist which are accessible and affordable or even free, which they should be. However, if people don't know about them, then that also serves as another issue that we're currently facing, right? So if we go and we look at the statistics now, and if this is the most mathematical I'm going to probably get ever in my whole entire life, because me and maths is a no-no. So just doing my own investigations, I'm going to read this out to you, and I just want you to really soak it in, right? So more than 13%, this is from 2020 now, more than 13% of the global burden of disease can be attributed to mental illness, right? And 3/4 of that 13% lies in low as well as middle income countries, which is very significant. And that's already an indication that there's a problem. People need help, people need support, but it means that people aren't also getting that support, right? This is what really struck me. Many countries allocate less than 1% of their health budget to mental health. And I think that's very concerning, right? And that goes back to the whole idea of when we think about health, there's sort of a hierarchy that comes with health, right? And it's very evident that mental health and mental illness have been at the bottom of the hierarchy because there's a dire need to want to solve all of these other issues and then neglecting this other issue. And it's not to say that other issues of health are not important, but it is to say that this is still an epidemic that we are facing, and it still deserves just as much support and just as much traction as the other aspects of health, be it physical, be it spiritual, whatever, are receiving, right? So then, for example, in South Africa, only 15% of people with mental illnesses actually receive treatment. And in Ghana and Ethiopia, it estimates that less than 10% of people in those countries are actually receiving treatment for their mental illnesses, right? Another very interesting thing, and I think that this is when we tend to sort of isolate mental illness and mental health from any other conversation, but we don't realize that all of these different societal issues and societal ills are all interlinked. They all link to one another. And this sort of shows that poverty rates are 2 times higher in people with mental health conditions, right? So that isn't to say that what it's saying. What it's saying, though, is that there is a correlation between people who do undergo intense or extreme issues of poverty and their mental health. And that makes sense, right? Because if we go back to our first definition, we were talking about mental health being a person's condition regarding their emotional, psychological, and behavioral well-being. And if you find yourself living in a very poverty-stricken way and having a very poverty-stricken life, then, I mean, obviously your mental health is going to be affected, right? And then this brings us back to the whole idea of the spectrum of the good mental health, the bad mental health, and then the moderate mental health. And I think it's important for us to keep on referring back to that and keep on understanding how all of this ultimately links to one another. So, people who are undergoing distressful situations such as food insecurity, job insecurity, we have the epidemic of the gender-based violence and femicide. All of these different issues ultimately affect people's mental health and how they're able to navigate themselves in society. And I think it's really, really important for us to not try and isolate the domino effect. They all affect and have a relationship with each other. So there's a clear relationship between mental health and the way in which society actually functions. And, you know, a lot of the time it tends to be this whole hierarchy of issues that we're trying to solve, right? It's like, no, we can't really focus on this right now because we're trying to solve, you know, poverty right now, or we're trying to solve job insecurity right now. What we don't realize is that by not paying attention to mental illness and not giving people who need treatment or who need care and who need help access, you know, to these treatments, what ends up being the cycle of nothing's helping anything, right? So an example here, it says that it is estimated that there is a link between mental illness and the lack of treatment with productivity. So it says that almost $1.15 trillion are lost a year because of the neglection of helping people and giving people, you know, the aid that they deserve if they have symptoms or if they have experiences of anxiety and depression. So what I'm trying to do here is show you that there's a link between all of this, and mental illness cannot exist in isolation, right? So this brings us to the question of, but why exactly has mental health been neglected? Like, why has it been neglected to the point where people who deserve access to treatment do not have this access or do not have their needs being, you know, met from a mental health perspective? So the first problem, sorry, I've got like a rolly chair. So the first problem is someone or there'll always be that whole idea of, you know, we've got a lot of issues right now that this one just really isn't a priority. So, and that's what I mentioned before, issues such as poverty, disease, gender-based violence, femicide, infant and maternal mortality, conflict, as well as right now we have the COVID-19 pandemic, which has also been really, really huge and quite devastating. And although we have all of these other issues, it does not mean that solving those other issues means the neglection of other important issues. And once again, bringing us back to the whole idea of all of these exist in relation to one's mental health and to one's well-being. And when people's needs are not being met, whether it be from a food security to a job security point of view, then ultimately their mental health is also being neglected. And I think once again, it goes back to that whole cycle of we're trying to solve one problem, but then we keep on creating another problem by neglecting this very important issue. I don't know why I feel like I'm debating because I wrote all of this down. All right, so the second reason why, or possible reason as to why mental health has been neglected, is because there's this ignorance, the stigma, and this lack of knowledge, right? And I had spoken about that before, but I want to jump to now the whole idea of cultural beliefs. So I read this one quote when I was doing some investigations, and I'm going to read it to you. And it says, and this was said now after one of the American singers, if I'm not mistaken, Robbie Williams, took his own life. And someone had said, I can't wrap my mind around the fact that depression is an illness. In fact, it is such a non-issue that African languages never bothered to create a word for it. And I'll say it one more time. I can't wrap my mind around the fact that depression is an illness. In fact, it is such a non-issue that African languages never bothered to create a word for it. And I think it brings us back to this whole idea of mental illness being un-African, or mental health being un-African, but mental health is life, if that makes sense. And when mental health is not sort of given or acknowledged, when, you know, the necessary urgency that it deserves, then we end up having a whole bunch of people who are suffering with mental illnesses, be that in silence or not in silence, and are they not getting the treatment that they deserve? And that's also because we keep on perpetuating narratives of mental health or mental illness being un-African or being, no, that's not a real thing, it doesn't exist. And I mean, obviously, if we speak about culture and mental health and mental illness, that's a whole different conversation, and it's a bigger conversation that we need to have. But I just thought it's something that's really important to touch on, because that's another reason as to why mental health isn't necessarily prioritized, especially then going back to how health, in some countries, health budgets, less than 1% is then attributed to mental health services or mental illness care and services and treatment. So if we go by step, we've spoken about how there's this inaccessibility of knowledge about mental health and mental illness. So depression as being, or any sort of mental illness being this non-issue. And an important thing that I wrote down here is how exactly are we starting these conversations? And that goes back to the whole idea of when we're stepping into different communities, are we ensuring that we are delivering this content in such a way that it's palatable to the context that we find ourselves in? Or are we just going into these spaces using this intense academic jargon and then expecting people to just understand exactly what we're referring to or exactly what we're speaking about? So are we making the effort to really want people to understand, the root underlying causes and meanings behind these words such as mental health and mental illness? We spoke about the inaccessibility of a clear and concise understanding, and that goes hand in hand with what I've just said. We spoke about, the stigma, the negative stigma that's surrounded by it, with it. And, I was reading another article which was saying how a lot of people who have mental illnesses are shunned, and they're shunned by their communities to the point where that causes people to not even want to speak about their mental illness. Never mind the fact that some people probably don't even know that they may or may not have a mental illness. And I think it's this whole idea of this negative stigma that causes people to suffer in silence, and then may also cause people to not actually want to seek treatment, because then seeking treatment is then admitting to the fact that one may actually need help, right? And then we go to the inaccessibility of mental health services. So I read a really, really interesting article, which sort of gave a really good outline as to, the state of mental health access in terms of the services to treatment and so forth. So this is from 2017, so it's just a little bit outdated. However, I think it still sort of frames where we were and possibly where we still need to go in order to ensure that we're actually actively trying to solve this issue of mental health being accessible to people, especially low-income individuals. So firstly, it says here that in Kenya, there are 80 psychiatrists and 30 clinical psychologists and less than 500 clinical nurses. And then it also then goes on to say that only 0.05% of the budget is then, related or attributed to mental health. Obviously, this can be so much more complex because of the different states of different countries. However, once again, I'm just trying to highlight the lack of urgency or just the lack of prioritization of mental illness and mental health. In South Africa, there's 22 psychiatric hospitals, there's 36 psychiatric wards in general hospitals, okay? And then it goes on to say that 14% of 53, in a population of 53 million people, have access to mental health care, even though 1/3 of every person in South Africa is prone to a mental illness. And then going back to then saying that 75% of mentally ill people in South Africa do not have access to, psychological or psychiatric care. And that's a big problem, right? Because we have these 22 psychiatric wards, but it's only open or it's only available to a certain amount, or even we could then even take it further to say a certain type or certain group of people who are then maybe able to afford or who are then maybe able to just access these spaces. In Nigeria, it says that less than 10% of mentally ill individuals have access to services. They are 130 psychiatrists, and they may be more now since 2017, out of 174 million people, which is shocking, right? And it's shocking because it just shows that there's a dire need for more urgency. There's a dire need for training for more healthcare professionals to be able and to be fully equipped in order to provide, this healthcare for people, this treatment for people who need this help and this care, right? And then the World Health Organization estimated that between 40 to 60 million people have disorders such as depression, anxiety, and schizophrenia, specifically related to Nigeria, right? Ghana, however, became one of the first African countries to address mental health through the mental illness policy, also known as Act 846, which is also really great to see that, there is this sort of trying or this need to try and, ensure that, okay, we're trying to address the situation. However, there's a difference between policy and implementation. I think it's very important to draw a fine line between the two. Then moving on, my debating notes. Then moving on, Sierra Leone only has one psychiatric hospital, and there might be another one now because this is in 2017. And there's a case study about how in 2015 there were about 104 patients within the psychiatric hospital, but they were in deplorable conditions. for example, is wearing chains and, you know, being attended to by staff that weren't even trained and fully equipped to try and handle this kind of illness or these types of illnesses. And I think that's really sad, because I think that, you know, people then start to associate mental illness and getting treated in psychiatric ward as sort of being imprisoned or being in a space whereby they're treated as if they don't have any of this, they don't have any autonomy. And I think that's another situation, that's another issue that we also need to look into, which may be the reason as to why people also don't try and seek treatment for mental health care, because they've heard about these conditions and they don't want to form a part of those conditions. So we go back to the whole idea of there's an important link between societal experiences and mental illness. And I think it's really, really important for us to once again reiterate the whole idea of these high rates of unemployment, of poverty, of crime, of food insecurity, substance abuse, gender-based violence, femicide, the list is endless. These all have an impact on people's mental health, and these all have a correlation to how people are able to navigate their mental health, as well as then the onset of mental illness. And I think that's a really important point that I want to stress. However, and I wrote here in capital letters, all hope is not lost. And I think it would be very unjust and unfair of me to invalidate and neglect the efforts from various NGOs and NPOs and different initiatives which have really sought to tackle the issue. But I still strongly think that although we have these different NGOs, NPOs, and initiatives attempting to tackle this issue, I really do think it all boils down once again to the government and, you know, what is this, how is this budget then being spent in such a way that it is still, you know, prioritizing the needs of those with mental illnesses and just ensuring that there are more mental health awareness programs in various communities and ensuring that people then know that they have access to these various, you know, sort of healthcare providers and so forth. So I'll just give you sort of two examples of two different initiatives, which I think are really, really great. And it just shows, you know, how possible it is to actually try and accessibly address, you know, the issue of mental illness within different communities, within different countries. So the first is called the Friendship Ventures in Zimbabwe. So I'm not sure if anyone's heard about it, but the whole idea of this project was to provide sustainable community-based psychological interventions, right? Which are accessible, evidence-based, as well as scalable. So the way in which this would work is that they would train different community health workers with skills such as administering cognitive behavioral therapy, as well as various problem-solving techniques. And then they would then have talk intervention therapy. So people who would want to go through this process would then have a screening process, and depending on the results of their screening process, would then be told whether or not they're eligible to have this talk therapy, right? So they would go through this talking intervention, but the most important thing, and perhaps one of the most interesting things about this, is the whole idea of how they recognized the need for an environment to be a very important factor. And what this means is that they would host these talk therapy sessions outside on a bench under a tree. Once again, showing how mental health is interlinked with, you know, different aspects and different dimensions of life. It's this holistic process that involves not only identifying an issue, but identifying an issue in such a way that's healthy for a person, right? And then after this talk therapy, depending on the person's condition and what the conclusions were, they would then be referred to or be placed in a sort of support group. And then the support group would be there so that, it's sort of translated to holding hands together. And the support group would then be there for people to really, you know, have that support from one another within this community and really build a community based on empathy and support and helping one another and understanding people's experiences. Another intervention, which I was really happy to be a part of on Saturday, is the Her Voice initiative, which takes place in Kaimandi. So on Saturday, I was invited to talk about mental health and mental illness to these ladies, and the whole idea of Her Voice is, you know, meeting the tangible needs of young mothers. So it was this group of young mothers who are dedicated to wanting to empower themselves as well as empower their communities. And something that I thought was really awesome and really important was how they were really, you know, trying to ensure that it was a holistic experience. So speaking about things such as mental health, speaking about things such as mental illness, and then trying to figure out, okay, so how do we make something like this more palatable so that when we go back into our communities, we're able to really start this conversation, but, you know, start finding ways that are more accessible. And one of these ways that are accessible is that they now have an in-house counselor, registered counselor, who is then there to, you know, provide counseling to the ladies if they need it, or to the women if they need it, as well as, you know, ensure that the women and their children have the support that they need. And these are just two ways out of a variety of different NPOs, NGOs, and different organizations that have attempted, you know, to actively and proactively try and tackle this issue. But additional ways is, once again, providing more community training. I think that a lot of the time within our different countries, we tend to sort of overlook how strong and how important communities can be in wanting to ensure, you know, I think it's the dissemination, I think, of information, right? And this can happen at a really small scale within our different communities. Are we using then the resources that we do have from this government or from our governments in order to ensure that there is some sort of resource or some sort of funding allocated to then training people in different communities and ensuring then that the people in different communities are then able to really attend to the needs of these different individuals in their communities who may or may not need help, right? Educating people about mental health awareness, ensuring that we're constantly doing national surveys on mental health, like asking ourselves, where are we right now in the state of mental health? What do people think about mental health right now? What are their conceptions? What are their misconceptions? You know, are we actively trying to understand where people are at? Because we also can't keep on implementing policies if we're not sure where our actual communities and where our broader society is at when it comes to this issue. And another thing is also outside of, you know, the government, and ensuring that, you know, more than just 1% of the health budget is allocated to mental health, is ensuring that we have various community-based rehabilitation centers or rehabilitation clinics, whatever that may look like. And although that sounds very expensive and probably very idealistic, it is something that is possible in the foreseeable future, so long as one stays dedicated to the cause. And I think lastly, the biggest point I want to make is the whole idea of we need to stop taking a reactive stance to issues such as mental health and mental illness. We need to start taking a proactive stance. And the proactive stance starts by, you know, starting at the 4 levels of inaccessibility. Are we ensuring that people are given general and good and sound information regarding mental health? Are we ensuring that people are, you know, given in this information in such a way that it's palatable to the context that they find themselves in? Are we ensuring that we are doing what we can then through those two in order to break this negative stigma regarding mental health and mental illness? And then lastly, are we taking all of these different steps and ensuring that we're finding concentrated spaces to try and ensure that there's more accessible room to not only talk about mental health and mental illness, but to actively try and give people, especially low-income individuals and people who don't have this access, such as the 75% of the South African population, are we ensuring that we are giving them this access that they rightfully deserve? So that's me. I'm not sure if anyone has any questions, but I thoroughly enjoyed this. And I just want to say that I'm also still trying to learn more and more about this situation or about this topic. And I think this has been a big learning process for me, and I hope that it's been a learning process for you. But I hope that we can still engage now and really speak about it more, because I'd be really interested to hear everyone else's opinions and viewpoints.
Hi. So you spoke a lot about the role that government can play, not only in policy, but also in execution. But I also think, you know, something that's important that I'd love to hear your opinion on is the role that private companies can play as well, in terms of creating spaces, creating hubs for people to get information, and just assisting government with programming around mental health.
So thank you so much for that. I think that's a really important point that you raised. And I think that, you know, once again, it boils down to a collective effort. And I completely agree that there are ways for different companies or different sort of constituencies within the private sector to want to try and create these programs. So for an example, in Stellenbosch University right now, there is a program that's being created in order to, it's titled The Intersections of Student Mental Health. And the whole point of that is to start to really try and educate students about what we mean when we speak about mental health. I mean, I've been at Stellenbosch University for 5 years, and there's still so many students who are so unaware of what we mean when we say mental health, or what we mean when we say mental illness. And I think it's important for different constituencies to start doing what they can in their own realms first, to want to address this issue, and starting off, like what I said, with the basics, and then, you know, going on to, okay, where to from here. So I completely agree. I mean, I'd love to probably research more about that, and see what other constituencies in the private sector have been doing. But I do think it's a collective effort. And I think possibly, yeah, just ensuring that there is this dissemination of information first, because I think that's one of the biggest problems that we still have, is this lack of understanding, which then sort of serves the enemy of progress or any other type of intervention.
Thank you. And then the other thing that I would ask is, at which point, you know, we think that education around mental health and also emotional intelligence should start for children. So perhaps incorporating that into school curriculums, so that, you know, I think it's harder. The brain struggles to adapt to new information the older that we get. And starting when kids are young, helping them understand, what does it mean when I feel sad, for example? What does it mean when I feel happy? How do I express those emotions? And then I guess I was reading a paper today that spoke about the role of parents, expecting parents, putting together programming around teaching parents what mental health is and how they would educate their own children, because the first 5 years of the socialization process takes place in the family home. So I mean, I'd just like to hear your thoughts from an academic point of view, if you've come across any studies or anything like that in South Africa taking place.
So I can't necessarily pinpoint the exact sort of study, but one of our lecturers in the psychology department, Dr. Bronwyn Gutierrez, so she works specifically with mental health pertaining to children, specifically from, you know, birth up until, you know, about a certain age. And I think what she said in the conversations that we've had, and what you've literally touched on, is to understand this from a very early age. There was another intervention that was actually done. There's another, I think it's a primary school in Stellenbosch, and sorry for using Stellenbosch so much as an example, but I think it's just because it's my immediate surroundings. In Stellenbosch, and basically what this primary school does is that they are a non-profit sort of organization, and they allow for different parents to come and drop off their kids. And the whole purpose of that, ranging from ages, I think from about 2 years old up until about 8 or 10 years old, is then they use different palatable ways to start teaching children about mental health and mental illness. And it was really, really awesome and very interesting. The lady came and she spoke to us, and it was interesting to see that process. So I think there are already people who have identified that that is definitely a need. But I think now the question is, you know, how do we ensure that, you know, other people, other constituencies are now, you know, seeing what other people are doing and then trying to adapt that into their very own context. And once again, like what you said, going back to the whole idea of parents as well, I think parents do play a very big role. And I think that a lot of the time when we see people not understanding mental health or not wanting to talk about mental health or mental illness, it also can relate back to maybe what the different cultural ideals and values are within that family. So I think that's important. And I think that these are the accessible ways we're talking about, because all of this is accessible. I think it's now just wanting to actually make a general effort to want to actually do it. And I've seen it happen, and I think it's very lovely to see it happen. And I would love to see it happen in more spaces, specifically relating to South Africa now. I hope that was fine, Mbai. Oh, great. So there's a question here. It says, what's your advice for someone who believes that they were misdiagnosed at a state institution but cannot afford private healthcare services? So that's really, really, really interesting, actually. I was having a conversation with someone who went through this exact experience, and they were sent to a state institution, and they went through the whole process, and they were ultimately misdiagnosed. And this had a very great impact on their lives, and how they were able to sort of identify their sense of self, and just process the different also medications that they were being given as well, because being diagnosed meant that they were being given medication, which turned out to be not necessarily the medication they should have been taking. So I think my advice is that, going back to, let's say, the Her Voice initiative, there are a lot of nonprofit organizations, or a lot of organizations which are there and open and willing, to be able to give people the help that they so rightfully deserve. And I think that my advice is to really, seek places within your own proximity which are accessible. And if you can't, then possibly maybe messaging someone or identifying someone who can help you with that process. Because I think it's important to immediately, tackle that, because a misdiagnosis is not something small. It's practically a misdiagnosis of your entire life. And I think it's important to immediately tackle that issue. So I can also send through a list. If this is specifically South Africa, like related to South Africa, I can send through a list of quite a lot of different places. But if it's not, then I'm sure that we can work together to try and find, a more accessible place that can really give the individual the care that they deserve, the treatment that they actually deserve. Any other questions? Or statements or opinions?
Sorry, one more question.
Sure.
One more question. Is there anything that it's actually two questions. Anything that you think older generations can do to help young people now more in terms of mental health? And then the second thing is, what have you found that is commonly practiced when it comes to the sphere of mental well-being and mental health that does not work from a academic and professional standpoint?
All right, so the first question about what do I think that older generations can do to help young people in terms of mental health. I think that something that I've witnessed, and this is now from my own experience, is that the negative stigma comes a lot from older generations. And I think it comes a lot from older generations because I suppose they found themselves in a different time where this wasn't necessarily emphasized as much, or even if it was sort of shunned upon, going back, to the whole negative stigma. So what I think older generations can do right now is, and I don't want to be that person who says educating themselves, but that's where I think it really starts. And I think that's what I've seen possibly in my own sort of family dynamics, as a whole idea of, parents or older generations wanting to then understand what do we mean when we speak about all of these things. And then it's then having that conversation and then trying to process that and realizing that, okay, this might actually be an issue. And I think perhaps really just, being open to understanding that this is a real thing. And it's hard because it's subjective and it's very relative. So it's very difficult for me to sort of prescribe what I think older generations can do. But what I have seen that has been done is just this openness and this willingness to accept that, okay, this could actually be a problem. What can we now do to help you and give you the help that you deserve? And I think this also boils back down to leadership. Like another article I was reading was speaking about how a lot of leaders also still hold, all the leaders also still hold, this very traditional viewpoint of mental health, which is why it also hasn't been prioritized. And once again, that goes back to the whole idea of, but it needs to be prioritized because it's a reality and it's a real thing. And it's a real thing that a lot of people are facing. But I definitely think that's a very good question. And then your second question was, what hasn't worked from an academic point of view? So I want to go back to the whole idea of mental health and well-being and wanting to navigate that being a very holistic process. It's a holistic process because I strongly believe that it involves, the unison, or at least a relationship between the mind, the body, and the soul. So I'm not going to say that if you just exercise and if you just meditate every day, that your mental health is going to be perfectly fine, because that's not how it works. I think it involves, utilizing a whole bunch of different types of techniques and strategies in order to want to navigate one's mental health and well-being. And I'm not speaking of people who now actually have mental illnesses, because that's probably even deeper, and there's a whole bunch of more complexities and specific things related to that. But for people who are just trying to navigate their mental health and their well-being, it's a holistic process. It goes all the way down to your physicality and ensuring that you're taking care of that. It goes all the way down to, what do you need to do that might help you from a mindfulness perspective, whether that be journaling and so forth. It goes back to, okay, what are accessible ways for you to maybe receive therapy, because you don't actually have to have an issue or a disorder to receive therapy. So really, from an academic point of view, it's a holistic process. There's not one thing that will work, if that makes sense. You don't just exercise and your mental health is fine, or you don't just meditate and your mental health is fine. It's a holistic process, and it's constantly, this trial and error to also really see what works for an individual, because there's a lot of different techniques and strategies people can use, but if it doesn't work for someone, it doesn't work for someone, and it's trial and error. So I think that's how I would answer that question. So yeah, I definitely believe in the art of holistic living. And obviously that's not always possible depending on an individual circumstances, but there are sort of accessible ways that one can attempt to try and do that.
Thank you.
Any other questions? No. I think Tanya, Saskia, no questions.
No questions. I've just enjoyed listening to other people's questions and your input. Thank you.
Awesome. No worries. I'm glad. I'm really, really glad. Yeah, I suppose then I would like to just say thank you so, so much to everyone for showing up. Once again, I'm a strong believer that, if one person shows up, that is all that matters, because it's someone who's being intentional, and it's someone who really wants to, learn more about a specific situation or a specific topic. And yeah, I've also learned a lot, and thank you, Mubaiwa, for your questions, because it's a lot of things that I actually want to, probably explore even more, especially the one that you spoke about in terms of interventions from a schooling perspective and from a parental perspective, which I think is really, really important. So yeah, I think without further ado, I'll say thank you to everyone for coming. I hope you have a very wholesome evening. I hope that you make yourself some tea or some wine, whatever your vibe is, some good food, and just enjoy. So yeah, thanks everyone.
Thank you. Thank you so much for having us. Bye-bye.
Thank you. Bye everyone.